Back, even if you've avoided the coronavirus, you probably haven't been spared the anxiety that's accompanied it. One way or another, the pandemic has left its mark on all of us. Now imagine that you're a healthcare provider who encounters this stress on a daily basis.
Chief Investigative Reporter Greg LaRose has talked to medical professionals who worry about the long-term toll of COVID-19 on workers in their industry and how it may affect you, their patients. He joins us live tonight from UMC in Mid-City.
Hey, Gina, we've used a lot of numbers when we've talked about the pandemic. Cases, hospitalizations, deaths, now vaccinations. And it's easy to forget that behind all of that data are people, and that includes the healthcare providers who day in and day out have to deal with their own fears and concerns.
I wrote if you want to call it a poem, I wrote a poem called Present Moment. You search for those facts which put your patient at risk, hoping to ease your own fears, to reassure yourself that you are safe. But there is no such relief. You don't know if you'll be next. And so you worry for your patients, and you worry for your family, and you worry for yourself.
It's usually second nature for healthcare workers to put their patients' well-being ahead of their own.
You know, I think sometimes the world may look at us as we're supposed to be perfect people.
Dr. Ebony Haywood Price says that selflessness has come at a cost during the pandemic.
That is emotionally very difficult. And I do think that for years to come, just like with Hurricane Katrina, we're going to be dealing with this emotionally.
A survey of more than 12,000 physicians last year found that 42% overall report they're burned out. That's not much different from 2019, but the specialists who've moved to the top of the list have been key during the pandemic: pulmonologists, infectious disease, critical care physicians. More than half of doctors who report feeling depressed say it's affected how they deal with patients.
Do we connect with them and empathize with them, which is what most of us choose to do?
Dr. Kaplan says it's typical for doctors to empathize with patients, to feel their pain, their panic.
And when we do that, we're going to pick up some of their energy. And unless we can find a way to channel it, it's going to get us sick.
With the feelings of detachment, perseveration, persistent negative thoughts, anxiety, things like that.
Ikoy Rooney leads the Louisiana State Nursing Association. She says industry forecasts predict 1 in 3 nurses will have symptoms of post-traumatic stress disorder based on what they've experienced in the pandemic.
So I cannot impress upon my colleagues more than now to make sure that they are doing everything they can to take care of themselves.
Doctors might be reluctant to admit they need help because they have to disclose any mental health condition when they renew their licenses. Dr. Kaplan has helped LCMC Health put together a program to recognize when caregivers need support. One of his outlets is writing, and he shares his work with colleagues who might benefit from the message.
Now a voice calls out, "Go home, now is not the time to be a hero." And you answer it with a resounding no, it is that time, because you know this is your calling. Retreat is not an option.
You know, there's evidence to support Dr. Kaplan's concerns about medical professionals leaving the field. Take a look at these numbers on your screen. One survey showed that more than a quarter of medical professionals are thinking about leaving their jobs. Another survey shows 8% of doctors closed their practices during the pandemic. Potentially that adds up to hundreds of thousands of healthcare providers simply walking away from their work. You can go right now to WDSU.com and find more on those troubling numbers and the doctors and nurses behind them. For now, reporting live from Mid-City, Greg LaRose, WDSU News.